Good evening. A year into the pandemic, COVID-19 has claimed the lives of more than 3,800 New Mexicans, and nearly 190,000 people have contracted the virus.
Most people who have died from COVID had what health officials call underlying conditions. So what are they, and how do people keep themselves healthy moving forward? Here's News 13's Gabrielle Burkhart.
Underlying conditions are very important related to the risk of getting COVID.
A year into the pandemic in New Mexico, health officials now know a lot more about COVID-19, including who is most at risk for complications and death.
Here in New Mexico, the number one condition, which we see pretty much worldwide, is high blood pressure, common in the population, but it is a vascular condition, and we know COVID-19 attacks the blood vessels in the body.
A state epidemiology report on COVID-19 mortality published this week shows hypertension or high blood pressure is the top listed underlying condition among COVID deaths. Second is diabetes, then cardiovascular, chronic lung, and kidney disease.
Obesity is number 6 on the list, but still a risk factor.
You can see death counts peaked in December and have gone way down since the vaccine entered the picture. Data shows daily COVID case counts have gone down statewide as well.
And one thing we know about the vaccine is that it does reduce the number of hospitalizations and deaths substantially.
Through gym closures and shutdowns, Dr. Scray says some people may have dropped their workout routines or delayed regular doctor appointments.
You know, this is a year-long struggle between the virus and humanity.
And while there are health conditions outside of our control, he says there are things people can do to keep themselves healthy moving forward.
It's those sort of things you say, you know, I really should be eating healthier. I really need to get more exercise. Pay attention to that little voice, because that's the part of you that wants to take care of you and wants to keep you safe.
Gabrielle Burkhart, KRQE News 13.
Dr. Scray says about 50% of people who get COVID have underlying conditions, and 77% of people who die from the virus in New Mexico had underlying conditions. You can read that full mortality report. Just go to always on KRQE.com.